we have been organizing as part of this working group different webinars. For example, last year we have early last year we have the launch of the guidelines of how to integrate disability consideration into evaluations. We also had some presentations of some practical experiences of some colleagues integrating disability considerations across the evaluation. And today we would like to continue sharing more experiences and good practices, but also some challenges that many colleagues across different organizations have faced when trying to integrate disability considerations. And today we will have 4 panelists. From the working group, we have first our colleague Nick from OIOS, who will be presenting the development of a guidance and checklist that has actually been the result of the biennial assessment, and he will explain more how the process was and how the process of the development of the guidance and checklist been. And we also part of the evaluation process is, of course, about learning. So we also learn from our past experiences and our evaluations. And our colleague Agnes from OHGDHR will be sharing the results and process of the meta-analysis that the office conducted of meta-analysis of evaluation findings on disability inclusion. And then we also have, and also as part of the UN disability strategy, we have the policy component, and our colleague Elisabetta from WHO will be sharing her experience on the planning stage of the evaluation of implementing the policy on disability in WHO. And then we have the other side of the content on our colleague Naomi from ILO, who will be presenting the results of an evaluation of disability inclusion of the policy and the strategy at the organization. And of course, at the end, we will have an open space where you can share your comments, your questions to the panelists, but also reflections based on the different presentation of the panelists. So I will just hand over to our colleague Nick, who will be presenting the experience of OIOS.
Right, great. Thank you very much for the introductions. Of course, colleagues, very happy to be here sharing some of our OIOS material. What I'd like to do is just sort of share two things with you. First, the results of our disability inclusion guidance, how we've mainstreamed that into our work, and then the results of our biennial assessment, which is a study that OIOS does every 2 years on the health of the evaluation function in UN Secretariat entities. I have stolen these slides liberally from my colleagues who have been involved in this work. See if while I'm doing this, you can figure out which ones I've inserted. So first, mainstream cross-cutting issues in evaluation. So the context here is that we had a lot, as does everyone. We have focal points for each of the mainstreaming issues. Disability inclusion, that's myself. At OIOS, environment is Ellen Vinke. Gender is Angela Revelo until recently, and now it's Jillian Baker. And human rights with Natalie Neal. We wanted to find a way to provide guidance to our whole division on how to integrate these mainstreaming issues and have it sort of be just one consolidated guidance. So that was our mission. In order to do this, we spent some time talking with colleagues, raising awareness about the issues, especially those that are newer on the mainstreaming agenda, like disability inclusion and environment. We held workshops to understand what some of the challenges are, what was difficult about integrating these, and also what some good ideas were. Really wanted to focus on practical considerations for design, and then ultimately to issue guidance, good guidance that could be used. Okay. So ultimately, what we came up with was these 6 areas that are covered by our guidelines. First is including mainstream considerations in the inception phase. Next is prioritizing cross-cutting issues during the scoping, including at least one evaluation question, having inclusive data collection, cross-cutting issue stakeholder data analysis, and then finally reporting and recommendations. A few things to think about this checklist. It's based very much on the Leave No One Behind principles. We're trying to take a holistic view, intersectional view of these issues. And of course, we used frequently the UNEG guidance on these. And of course, the most recent one developed was the UNEG guidance on disability inclusion, which I think Roxana linked in the beginning of this chat. We also started collecting things like good tools, evaluation questions and indicator banks, additional online resources, trying to put all that together so that our colleagues could sort of easily find what they needed in order to do this mainstreaming. So now what I'll do is I'll just sort of go quickly through what's entailed. So for evaluation planning, okay, so parts 1 and 2 of our 6-point checklist really are about evaluation planning. Here we're encouraging colleagues to consult the professional standards, UNEG guidance, to really consider the issues in the background research, initially discuss this with the evaluand so that they are thinking and expecting us to consider these things when we evaluate their programs. Considering mainstreaming in the theory of change design, certainly important, and seeking out relevant expertise. Basically, the theme here, folks, is, if we start strong, we finish strong. So to think about these issues in the beginning. When we get on to evaluation design, again, we're considering the issues in the design. So there are a lot of ways to do this. We provided suggestions and options such as kind of embedding evaluation questions either directly into the existing evaluation questions that you might have for an evaluation, or breaking out new or separate ones. But giving some examples and ways to do that so that it makes sense, so that it doesn't feel like an additional exercise, but rather something that's well integrated into the design and can sensibly inform the tools that we use to collect data. Moving on to number 4, that's data collection. Here we're talking about mainstreaming issues into instrumentation. Thinking about how we're going to collect data on these on the mainstreaming issues, including disability, and how we might go about disaggregating that. Conducting accessible data collection. This relying on guidelines on how to make sure that our data collection tools are accessible. That we're communicating in modes that make sense given the audience, and being inclusive, making sure that we have sort of a wide array of stakeholders, and certainly stakeholders either themselves being persons with disability or representing those that would have a stake in the program, and ultimately, of course, adhering to ethical standards. Thinking about data analysis, so we go out and we collect all this stuff. We try to make sure, like everyone else, that we analyze everything that we collect. We collect it for a reason. So we're triangulating the data across different modes. We're making sure that disability issues are included in more than just one mode of data collection, so that we have a basis for triangulation, and we disaggregate wherever it's possible. Just making sure that we use sort of those good tools. When we get down to reporting and recommendations, here, really what we're talking about is focusing on making sure that whatever we find on disability inclusion in the program that we're evaluating, or the sub-program that we evaluate, is brought up to the surface. We want to ensure that there's an overall results statement or finding in the evaluation that specifically speaks to this. And sometimes we might find that there's no, that there's not much there. And I think that that's fine. It's important to air that, to bring that to the surface. If there's something that we can recommend, or where the report findings beg a recommendation on disability inclusion, we'll make that recommendation. We encourage all of the teams to do that. And then finally, providing supplemental analysis where useful. So, depending on the entity, some entities I think will not have strict word limits on their reports. We at OIOS, all of our reports have to meet sort of the GA format. So that means 8,500 words. Sometimes you can't talk about everything, and that's okay. But what we do is where we can, we provide supplemental analyses, additional pieces that might help the evaluand further unpack an issue of disability inclusion that we maybe can't fully do justice to in the report. We've been using this guidance for about the last year, and so I thought it might be interesting to see what that looks like for us at the end of the year. So we started the year only approaching the requirements for Indicator 10 on the UN Disability Inclusion Strategy. Now we meet the requirements. Still more work to do, of course. You know, of the 7 evaluation reports that we finalized in the year 2022, all of them met UNDIS requirements. Now, UNDIS requirements are that 4 of the 6 criteria are met. So we still have work to do, but all of them meet criteria. And then I'll highlight here in red, sort of clever way of identifying problems, but our experience has been that getting people with experience on disability inclusion, or at least the right people to advise on the evaluation reports, this is still a difficult area for us. We tried to address this mainly by having the disability inclusion focal point, read all of the inception reports and advise. And we actually did this for all of our mainstreaming issues. What we found after a year of doing that was the focal points were tired, but also that it at least had gone some ways to sort of socializing the issue and making sure that the terms of reference, our inception papers for evaluations, were including these issues. And now that's left to just the teams to do in their regular course of reviewing and starting their work. And we think that is probably a more sustainable way to do it. 71% of our evaluations had questions that covered different aspects, as in more than one aspect of disability inclusion. But in the other third, it's only one question looking at sort of whether or not disability inclusion was mentioned. Really challenging area for us was involving persons with disabilities and their respective organizations. This requires, more thought, more outreach. Some of this as well is based on, looking back at programs that were not yet incorporating, the UNDIS requirement for inclusion. And so they weren't necessarily dealing outright with those organizations. So we hope to be able to do better on this in the future. Happy to report that 100% of our teams analyzed the data and evidence that they collected on disability inclusion, though in a couple of cases they weren't able to find space in the report to reference what they found. Again, opportunity to improve there. And finally, just over half of our evaluations made conclusions and recommendations on disability inclusion. We don't want to make recommendations for no reason. So sometimes there's that issue, but as programs now further and more deeply incorporate disability inclusion, we'll be attentive to finding more avenues for that. So that's sort of where we are, some of our concerns about our own practice and where we'll go. And then maybe for the next part, just to highlight a few quick findings on the biennial review. You can see the project team there, Zainab Latif, Maria Goldman, Maria Delgado, and Janelle Morona, Catherine Nyawire, and Yuan Ching Ho. Excellent group of evaluators that put this together. I'm going to try to quickly do justice to their very good work. They unfortunately couldn't be here to deliver this due to mission travel. So the context. So every 2 years, OIOS does this biennial review looking at 75 entities in the Secretariat and the health of their evaluation functions. The review basically includes looking at evaluation reports, reviewing policies, interviewing staff, looking at the funding and survey of focal points to collect the data. key findings from the latest review. So this was the first time that we incorporated disability inclusion in that assessment. We didn't use it as part of our rating yet. We provide ratings of all the entities. We're thinking of this as sort of like a baseline year. Next year or the year after, we're going to include this in our scoring of the entities. And if I just were to summarize everything, basically we could say that disability issues were found to be weakly integrated in evaluation reports during the year 2020-2021. But there are still some good practices emerging, and there are, of course, reasons why we found that there was weak integration. So key findings on disability inclusion. So weakly integrated in 2021. You can see there a handy graph from the report showing that of the evaluation reports that we considered, a big group on the right are not integrating disability inclusion, but there are others that are. It's a smaller group. The key challenge is really it's not easy to accommodate in the mandate of the entity, or at least it wasn't yet at that time. Mostly this has to do with those dealing more with population issues or less normative type programs are going to be more easily able to incorporate this. There's a lot of cross-cutting issues that need to be included. This was something we heard frequently. There wasn't guidance yet. And of course, now in 2022 and 2023, there is guidance. So we hope to see that improves. And and time. Just a reminder that for a long time, disability inclusion was difficult it took some time for gender and unswap to sort of take hold, and now it is, and we're starting to see that changed. We expect sort of a similar pattern for disability inclusion. Okay, I don't want to go too far over time, but just to say that there are some good examples in the reporting that we found. So, for example, in this OHCHR evaluation of Cambodia country program, you can see that there was good stakeholder consultation, and of persons with disability, and we saw that integrated sort of throughout the report. So that's a good practice. Another good example here, this is a UNECE evaluation where there were specific questions that focused very much on disability inclusion and checked whether or not this intergovernmental process was making consideration of those issues. And then finally, in an interagency evaluation of humanitarian relief to the cyclone in Mozambique 2020, we found that, again, it was disability inclusion was part of the criteria used in both sort of sampling who to speak to, that they, disaggregated the results, which was very good to see. You can see that in the table on the right. And you can see the conversation in the report was sort of asking, well, okay, so in this relief situation, how well and in what way were the rights of persons with disabilities considered? So those are some sort of examples of good practices. With that being said, I think I will stop. That's been our OIOS experience and some of what we've seen around the system in the Secretariat. I'll also throw in some links into the chat to where you can find the material that we've referenced. Thank you, colleagues. Over to next presenter.
Thank you so much, Nick, for taking us through the process of how OIOS have incorporated and developed this guidance. I see that we have a question here just on the recording and presentation. So yes, this session is being recorded and then it will be uploaded to the UNEG website. And if there is not objection from the presenters, I think we would be happy to also share the slides afterwards. And yeah, thank you, Nick, for also sharing any additional resources. And now, I just would like to congratulate you for the progress that you have done over this topic across the years. And now we will actually hear one experience from Agnes on how they have gone a bit further and doing this meta-analysis exercise to go from meeting to exceeding the requirements in the indicator. So over to you, Agnes.
Thank you, Roxana. Thank you, Nick. Good morning, good afternoon, colleagues. I think Nick has mentioned a lot of things that will be in this presentation, so I'll also try to keep it within the time limits. I'll be presenting on the meta-analysis that we recently conducted, which focused on disability inclusion in OHCHR evaluations. So to start us off, as part of our evaluation policy, we usually conduct a meta-analysis that looks at the overall findings at the end of each programming cycle. And for this year particularly, we are at the end of our current programming cycle. So within that meta-analysis, we look at different parameters, including aspects like gender integration, gender equality integration, and also disability inclusion. So disability inclusion findings, we classified them under one of our pillars that we have on our OHCHR management plan, which we call the OMP. So this pillar is the non-discrimination pillar. We also classified it under one of the organizational effectiveness action plans called the Diversity and Inclusion OEAP, and also a spotlight population that we have, which is the persons with disability, alongside the other spotlights, which is youth, women, and persons of African descent. We also looked at the operationalization of the UNDIS within OHCHR. We have the UN Human Rights Disability Rights Policy, which was introduced in 2020. And we also have an accompanying strategy as well. And since then, we've had other guidelines that have been on mainstreaming disability inclusion within all the processes at OHCHR. So the objectives of the meta-analysis was mainly to just look at our quality of integration of disability inclusion within all the evaluation reports that we've had throughout the cycle. And this cycle is 2018 to 2023. The initial cycle was 2018 to 2020, to 2021. And then we extended it to 2022, 2023. This meta-analysis will also provide input for the next now OMP, which starts 2024 to 2027. Also, just to exceed the requirements of UNDIS, because as per the last report that we did, we had met all the expectations. And the audience mainly was the entire OHCHR colleagues, also with a lot of recommendations specifically to the Policy Planning, Monitoring and Evaluation Service, PPMES, the Human Rights and Disability Unit, and all the project leads. As you will see, we have different findings and recommendations for the entire programming cycle. So we used a mixed method approach. We looked both at qualitative and quantitative data. We had two phases of this where we had the data collection, and here we looked at in total 44 documents. This included all the evaluation reports conducted during this period. We also looked at the UNDIS annual reports that we did for 2021 and 2022, and we also looked at the OIOS biannual report that was recently done. As Nick mentioned, it was the first time they looked at disability inclusion as well. And then all these findings have been collated in our internal performance monitoring system, where colleagues can refer to in all the processes that they have, from planning to reporting. Part of the limitations is similar to what Nick mentioned as well. The disability inclusion indicator, the framework was only introduced in 2022, the guidance. And so some of these limitations may be attributed to the lack of clear guidance previously, but we looked at the existing frameworks and policies that we had before, since the beginning of the cycle, towards even after the different guidances were introduced. So for the first aspect that we looked at, according to the UNDIS requirement, was disability inclusion in the evaluation guidelines. And we looked at different evaluation guidelines. Here you can see we have the evaluation policy, which is currently under review. We have the OHCHR results-based manual. We have the OHCHR model terms of reference, and we have the OHCHR guidance on preparation of evaluation reports. All these different guidelines were found to be disability inclusive, with different instructions and different guidances, including the fact that PPMES was responsible on the quality control of the evaluations, including on assessing disability inclusion, and the OHCHR model terms of reference. So as I mentioned, the terms of reference model, which is found to also be a good practice in the OIOS, as you will see in the coming slides. So the next section, we assessed the 6 elements, and we saw that according to also the annual reporting of UNDIS, we had met all the requirements as per the 6 elements. And the first one was on the terms of reference, where out of the 23 internal evaluations that had been assessed since the new model terms of reference, which had included disability inclusion, 87% had outlined disability as part of the 7th evaluation criteria. So the 7th evaluation criteria that we have added in our terms of reference is gender equality, disability inclusion, and human rights integration. So along the 6 other OECD criteria, we also include that as part of the assessment in evaluations. With regards to the evaluation teams, we also, in our sending out of the calls in the screenings and also in selection, we look at the knowledge and experience of the evaluators in terms of conducting disability inclusive evaluations, and also look at whether they have the experience in developing different guidance in terms of just the whole aspects of leaving no one behind. In terms of the evaluation questions, since we have the 7th criteria as gender equality, disability inclusion, and human rights integration, we always have questions as well, usually about 1 to 2 that assess whether in planning and even in the results that have been achieved, they have ensured that there's disability inclusion. And we also look at, we also saw that in cases where this had not been done, evaluators included evaluation questions that were forward-looking. So they were looking at, if this is not there, then how can we ensure that disability inclusion is integrated in the next phase of the project, or in the next in the next planning in different aspects of that particular project that is being evaluated. In terms of stakeholder and data collection, we also saw that although the methodologies that the evaluators used and the approaches that we had to ensure that we had stakeholder consultations, including persons with disabilities, there was a challenge if the disability inclusion had not been planned for since the beginning of since the inception of the project or program, and even during the implementation. So this was a challenge. If the focus was not there initially, then it was also a problem trying to later on at the end bring in the voices of persons with disabilities. But we also saw that some evaluators still had that as part of their stakeholders, and also in terms of data collection, just to also again look at in future what could be done. And then in terms of findings and analysis, 94% of the evaluation reports that had been conducted from 2020, at least since the UNDIS was launched, and at least since we started having some sort of clear internal guidelines, we found that all of them had been disability inclusive, and they had addressed either in terms of the evaluation questions, in the methodologies, or in the findings, and most of the gaps had also been brought out, and actually all of them had recommendations in terms of disability inclusion. And then in the conclusions and recommendations, as mentioned as well, that was also there. And one of the conclusions was that disability inclusion is an important area of focus. And though it's not been adequately mainstreamed, we can still see that there is progress towards mainstreaming this throughout, from the time of planning to implementation, which will also inform towards the end at the time of evaluation. And as I mentioned, we also looked at the OIOS findings of the biannual review. I think Nick already covered some of the best practices here, but just as I mentioned, our model terms of reference was found as a good practice because of us including it as the 7th criteria. And we also saw that one of the best practices was the evaluation of the Cambodia country program, which had included future recommendations for future evaluation practice and also had included this as a criteria as well. So coming towards the end, looking at the meta-analysis summary of conclusions, as I mentioned, OHCHR has disability inclusive frameworks, policies, guidelines, and the office has been successful in meeting the requirements in line with UNEG. And we've seen in different aspects, this includes in involving beneficiaries and partners, in the activities and in the materials that we have developed throughout the different projects, by having a reasonable accommodation funds and including this in terms of planning and budgeting within the programs and also in the recruitment. We saw a lot of projects, especially the ones that look at the fellowships. A lot of the projects had included persons with disabilities as well. And some of the best practices we also saw is that disability inclusion was very strong in the projects that addressed disability inclusion as a cross-cutting and intersectional issue, and also the ones that had included disability inclusion from the design to planning to implementation to the results framework and also as a target beneficiary group. So most of the ones that we found to be successful in this had included it from the beginning to the end of the project cycle. And then I come towards the end of my presentation, which looks at the recommendations. And in this, we have two phases. The first one, we looked at just ensuring that we meet fully all the expectations under the 6 elements. And in terms of the terms of reference, just making sure that we have active participation of the disability team from the time of the development of the terms of reference to also incorporating guidance materials. We have a lot of very useful guidance materials that could be incorporated as well in the TORs as links, just so that it can be useful to colleagues in the implementing the projects and also the evaluators themselves. And finally, ensuring that explicitly mentioning disability inclusion in the 7th evaluation criteria, just as we have it in our guidance. And then in terms of the evaluation teams, of course, again, ensuring that it's explicitly there to include the profiles, making sure the profiles are disability inclusive throughout the process of putting together the evaluation teams. And then in terms of the questions, since we'll have also the 7th evaluation criteria, in case we have a situation where disability inclusion was not planned for, or it was not implemented, or you could see that there was no, like, for example, disability disaggregated data, we could look at forward-looking questions. As I mentioned, the forward-looking questions, at least we saw that they were able to bring forth perspectives of persons with disabilities on what they would ideally like to see in future. And also including a question not only on what has been done or what could be done in terms of the strategies, but also in terms of accessibility and reasonable accommodation. So we could look at whether the facilities where, for example, we had the meetings or transportation, if it was used in the project, just different aspects, whether they were accessible for persons with disabilities within the people that the projects were reaching. In terms of stakeholder mapping, as I mentioned, desegregation of data, and also provision of accessibility and reasonable accommodation. And then in terms of evaluation findings as well, again, insisting on the accessibility and reasonable accommodation aspects. I think this is something that we did not see in a lot of the evaluations, if not all actually. And in future, it's something that we will be paying close attention to. So the last part of the recommendations was looking at some office-wide programming recommendations. As I mentioned, there are a lot of good practices in terms of planning on disability from the time of the design and also budgeting for it. So in terms of program project design, we're looking at making sure that disability inclusion is integrated throughout, and also making sure that part of the target groups is persons with disabilities. Also making sure that disability inclusion is integrated in reporting processes, including in other internal monitoring processes and at the end of year reporting. Also in the different activities that we have, like capacity building and training, and at the end also widely disseminating and ensuring the effective use of the guidelines. And then reasonable accommodation, as I mentioned, making sure that we plan for this and we budget for this so that it can be planned for from the beginning till the end. And lastly, in terms of OHCHR opportunities, making sure that disability inclusion is adequately mainstreamed in all the opportunities. And also we had one recommendation as well on conducting a mapping exercise where we'll identify persons with disabilities as part of our OHCHR staff. So I've come to the end of my presentation. Sorry for the hiccups at the end, but thank you. That is how we went about our meta-analysis, and I hope you found it useful. Thank you.
Thank you very much, Agnes, for this interesting presentation. And I think that's something that we have seen in the first two presentations is the importance of the inception phase and the planning phase on how to incorporate disability issues since the beginning and to pay attention to these preliminary phases. And following that logic, our colleague Elisabetta will be presenting this inception phase of the evaluation of the WHO policy on disability. Over to you, Elisabetta.
Thank you. So as you said, the evaluation of the WHO policy on disability is just starting. So all I present is the future. And we are very lucky that after my presentation, there is ILO presenting on an evaluation, a very similar evaluation that they just did. So I think it would be complementary, and I'm really looking forward to the next presentation. So I'll be very quick with mine. 2019, the UN Secretary General launched the UNDs to mainstream disability inclusion in all areas of the UN work. You all know that. And in 2020, as in many of your agencies, if not all, WHO developed a global policy on disability to becoming an organization which is inclusive of people with disability in all their diversity. The purpose and objective, I put them together here to be a bit faster, of the evaluation are first institutional learning and then accountability. So the order is not a coincidence. It's really about learning. It wants to be a formative evaluation and forward-looking. And the idea is to review to which extent the disability policy has been implemented across the three levels of WHO. That means the global, the regional, and the country level. So it's really the entire organization, and this is a big challenge for those type of evaluations because it's really a large audience. And I'm eager to hear how ILO managed to do something very similar. The idea is also to identify factors that hinder or support the ability of WHO to integrate disability and to have recommendations that should help the implementation of the policy or possibly the revision, depending on what will be. We developed together with the UND Secretariat in the organization 10 questions. We didn't want to have more than 10, and we organized them through the classic OECD criteria, I will not go through all of them, but to the ones that I think are more interesting, but this is a personal choice. I think they're all important, and they were developed together with our program colleagues on disability, and as I said, the UNEG Secretariat. One is about relevance, question 3. To what extent is disability inclusion, and responsibilities understood within the organization? So the fact is not to assume that everybody understands those concepts at the level we would want. There might still be some different views and understanding, so it will also be an aspect assessed through the evaluation. Then on question 4, and there will be other questions under effectiveness that is very similar, we want to check the level of satisfaction among staff, consultants, interns, volunteers. So we're speaking about 17,000 workforce, about 17,000 workforce on the content. Sorry, 17,000 is the entire workforce, but of people specifically living with disability within this workforce on the content of the action plan. Is what is in there really what should be there? And then we'll assess the same things under effectiveness by asking, is it implemented in the way that, that is effective and really responding to the needs? We also try, question 5, to assess the extent to which activities are prioritized. And it's not an easy question to ask because there is a lot of ambition and it's an area where we want to be and need to be ambitious, but it's also important to prioritize. So we'll check and see if we need to prioritize and how. And then we'll look for effective practices across the level of the organization, since the evaluation is about learning, as I said before. There is also a question on sustainability that will check what will happen after 2024. In WHO, there were some flexible funds linked to UNDs that help the custodian departments of the different areas of the action plan to implement what they were meant to. But starting 2025, it will be different. People need to allocate budget from their own budget, so it will be a big test in terms of actual ownership, mainstreaming, and integration. So it will be a good area to look at. In terms of methods, I'll only highlight the fact that we want this to be participatory, and maybe you have experience with that. We would like the tools to be developed with people with disability to make sure that the right questions are asked in those tools. It's a mixed method approach, qualitative, quantitative data. This is very classic. The good thing is that we have a good UND's monitoring system, so it will be very helpful. And that there is a wide survey that the organization is already carrying out by the end of this year, not so much on accessibility, stigma, etc., but at least on reasonable accommodation. So the idea is to identify area through the survey that we could go and analyze deeper through the key informants and the focus group. So we are lucky enough that there is at least not a complete survey, but a survey to use as a basis. This is the last slide, and this is about issues. I did this slide because I hope that not only ILO, but maybe other participants in the call can help with some of these issues that we are dealing with. We don't have, as I guess other agencies don't, baseline on the workforce in terms of people with disabilities. So it's a bit difficult to be inclusive when you don't know the needs, really, in a sense. And it probably would be different in some years, but this is where we are now. And we want to ensure participation of people with disability in all their diversity. So this is another challenge, is like how to include also the people that might be less visible or less vocal, and really in the diversity of the workforce and their needs. We anticipate some need for reasonable accommodation in the conduct of the interview and focus group themselves, but not knowing the needs is not easy to plan for that. So it will be useful and good to know if you have experiences on that area already. Another issue is how to best synergize with the gender equality colleagues in terms of learning. They have similar issues. They also have a twin track approach. So there are a lot of similarity and also interlinkages, but we don't want to make things more complex than what they are already. So it's like how to work together and synergize on gender equality and disability. The sampling strategy is not easy when you deal with the three level of the organization, and we would also want to include not only good practices but also less successful cases that are important for learning. So if you have any experience on how to get to less successful cases and have people eager to share those, welcome. And as in many evaluations, we would like method to be innovative. So any idea on innovative methods are also very welcome from the audience. Thank you.
Thanks a lot for the great presentation, Elisabetta, and also for the reflection points at the end. Just being aware of the time, we will first hear the experience from Naomi, who also is in line with the previous presentation. Yeah, Naomi, offer it to you.
Thank you, Roxana and Elisabetta. I hope that I can answer some of your questions. So good morning and good afternoon to everybody. My name is Naomi Asukai. I'm the Senior Evaluation Specialist in the ILO's Evaluation Office. I'm from Japan. My pronouns are she and her. And today I'm wearing a dark blue shirt and a blue and green cardigan that you might not be able to see. Today, I would like to present the ILO's experience in evaluating the ILO's disability inclusion policy and the strategy. So a very short background to the evaluation. This independent evaluation, it was called for in the implementation report of the ILO's disability inclusion strategy, which was submitted to our governing body in October 2022. And it actually called for an independent evaluation to take place in 2023 with the objective that we needed to gather lessons learned from the implementation of the current strategy and then make course corrections and contribute to the development of the next strategy, which is expected to be 2024 to 27. And it also, of course, addresses the call within the UNDIS, as we all know, for regular monitoring and evaluation of the policy. Now, if you all read my last bullet point several times, please, because this was actually requested and insisted upon by the evaluands. Now, that's the Gender Equality, Discrimination, and Inclusion team. We call them the JEDI team. They're the overall custodians of the UNDIS and the ILO Disability Inclusion Strategy. So I don't know about your organization, but in my organization, we don't have people lining up outside my office volunteering to be evaluated. It's quite a rare occurrence. And we did not have it as a corporate evaluation. We have 3 corporate evaluations a year, and this was not planned to be one of them. But they insisted and they kept asking us for it. And, you know, we're not going to let such a great opportunity pass us by. So we decided to take this on, even though it wasn't really part of our work plan. So in terms of the preparatory work, we began with the identification of an evaluation manager, as this was going to be an independent evaluation, and it was co-managed by me in Eval. We knew from the start that incorporating disability inclusion into the actual evaluation process was going to be very important. So referring to the nothing about us without us. And since the JEDI team were keen to also see this evaluation, we actually got very close coordination with them on what disability inclusion in the evaluation process would look like. We launched a call for an evaluation team, made sure that we included language on reasonable accommodation should evaluators require them, and we disseminated our call through our usual procurement channels, but also through technical subject matter forums, which our JEDI team colleagues were part of, and we tried really hard to reach out to those that are beyond our usual evaluation channels. We also had what we call a prior CPO analysis. This is country program outputs. So we took a look to see the portfolio of ILO's development cooperation projects to see what kind of how ILO is doing in terms of its projects and programs on including disability inclusion in our field work. So this was actually done as a separate exercise, but it fed very much into the actual data collection. We were able to use data from that analysis into the actual evaluation. And yeah, when we received actually the expressions of interest following our procurement process, we found that there were no requests for reasonable accommodation. So we did not receive any expressions of interest from those that had the lived experience with disability. And so we felt that we needed to go further than that we needed to actually ensure the voices of the people with the lived experience on disability inclusion. And so we decided that we would go for a reference group as a feedback and review of the evaluation milestones. So here, very quickly, the reference group was set up to contribute to the relevance, credibility, and utility of the independent evaluation as an advisor, providing a range of viewpoints. And we identified the members of this group with our JEDI colleagues, with our JEDI team. And it was finally constituted by members of the International Disability Alliance, the UNDIS Secretariat, UNICEF colleague who formerly was with UNDIS, OHCHR colleague who's a disability advisor, and we also had members of what we call the ILO's Employee Resource Group on Disability Inclusion. So this is ILO staff who have disabilities or who have family members with disabilities, and they have actually a group within the ILO that discusses issues, and members of that group were part of our reference group. And the TORs for the reference group actually tasked them to review the key milestone products of the evaluation. So the inception report, the interview protocols, draft and final reports. And we estimated that each member would be requested to volunteer about 15 hours of work for the whole process, which spanned 15 hours of work over 4 months. So the kind of details here, as it was unplanned, so not one of our usual corporate evaluations, we actually had not planned or budgeted for it. So we actually had an overall budget of 25,000, which is actually quite small for an organization-wide evaluation. Given the budget, we decided that we would go for independent evaluator or possibly 2 evaluators rather than going for a big company. But also depending on who answered our call for expression of interest. The scope was all of HQ and the field, all departments, the ILO staff union, and then ILO employee resource group. And we had the usual kind of methods in terms of a desk review, key informant interviews that were done remotely for the field, but in person in headquarters. We had online surveys with what we call the disability inclusion champions of the ILO and the ILO UN, the UNDIS indicator custodians. And then we had 2 workshops in terms of like reporting back and validation, one for the ILO staff and one for members of the reference group. And then we finally had, formal written comments to the report for finalization. The evaluation interviewed 65 colleagues in the field, headquarters, also some external stakeholders, and we sent out a survey to 86 staff members who were selected for their responsibilities related to the ILO disability inclusion strategy and policy across all ILO departments. So ranging from technical departments to our HR, to our internal services, property management, and facility colleagues. We were quite happy with the response rate of the survey, which was 62%, which is quite high for us in the ILO. Usually we get about 20% response rate. So this was actually a very good response rate. Once the draft report was received, so the evaluator made a presentation, and this was actually a very important step in terms of feedback, but also for the colleagues to come together. I saw that they were already discussing how they're going to implement the recommendations or what they're planning to do as next steps. And it was also a very unique forum because it brought together many of the departments and regions in the ILO that don't actually normally sit together in the same meeting. So they were able to discuss disability inclusion. Someone from IT was talking to someone from facilities, and HR was becoming involved, and then the technical department. So it was a very good forum to bring everyone together. I have a few slides on the key findings and recommendations. I don't think I'm going to go into all of the details, but I'm going to keep it in the slides. So if anyone would like to see the presentation later, you're welcome to read through them. One of the key findings I did want to highlight, and I think Elizabeth also mentioned it, was the finding that the policy and strategy, the current policy strategy for ILO was missing gender equality and social dialogue issues, and that the next challenge for the next strategy to be developed was how to ensure the intersectionality concerns and how to bring those more to the forefront. And that would also, of course, help ILO work together internally more closely. So I'm going to skip these slides in the interest of time, but I just wanted to point out some key enabling factors, I think, that really helped us in terms of this evaluation. First, we had an enthusiastic person, a department, a custodian who was really keen to have the evaluation. They really thought the findings of this evaluation could help them develop the new strategy. So that goes a long way. The ILO also has a reasonable accommodation reserve fund. I don't know if other organizations have this as well, but we were able to, with our relatively small evaluation budget, we were still able to provide that because we have a reserve fund. In the end, we ended up not using it, but the fact that it's there, it helped us in terms of not having to budget for it. The ILO also has an employee resource group that's made up of, as I said, staff members who have the lived experience with disabilities or have family members with disabilities. And we also have a very strong staff union component who helped us with identification of the issues that they're hearing, and then also helped us in identifying the people who we should bring together for focus groups. So currently the ILO has no statistics on how many staff members have disabilities. And so, we really actually needed those two groups to help us identify and come and find our sample of people to talk to. So without those, it would have been very difficult to just walk around and try to find colleagues who would be interested to talk to us on that. And of course, I mentioned there was prior work on the analysis of the ILO's development cooperation portfolio, which really helped in terms of helping us with the data collection and getting more into depth on how is the ILO doing at all levels, going from the projects that we're doing on the ground all the way up to the institutional and corporate side of things. And then in terms of the next steps in completing the evaluation, I just received the final report from the evaluator. So we will be looking to finalize the report in the next few days. And we intend to disseminate the report more widely. We're going to use it to inform the next strategy, I hope. And it's also a good experience and background because we will be undertaking a high-level corporate evaluation on the topic in 2026. And that will be a much bigger exercise with a much more healthy budget. But the things that we learned from doing this evaluation process already will really help us make sure that the next one we do is also as inclusive as we can be. So thank you. And over back to you, Roxana.
Thank you so much, Naomi, for presenting this exercise that is, I think, very interesting. Just seeing that we have already approached the 1 hour time, I just would like to ask back to either to the panelists if there is any burning issue that you would like to share, or if anyone in the audience would like to share anything before we close the session. Any final remarks, either for the panelists, maybe some key takeaways, or from the audience?
Maybe just to fill the space, I would just say that, like, from where we sit, I'm encouraged that the challenges that OIOS has experienced with with disability inclusion, and as well our observations of other evaluation functions seem to be sort of in line with what my colleague presenters have been identifying, and I am really encouraged to see the solutions that they've come up with. I mean, colleagues who presented a lot of very good examples of how to action this requirement for disability inclusion. Things that certainly OIOS is going to take on board. So from my humble position, thank you very much. Excellent work done.
Thank you, Nick. And if anyone else would like to add anything else, and also looking back at Sabbath, if there is anything else you would like to share from the working group on disability, gender, and human rights.
Roxana, thank you, colleagues. A very interesting exchange of experiences. Thanks a lot for that. I've mentioned in the chat, and we have a proposal to the organizing committee to have a professional seminar. We'll see if this is approved, but at least we will have the sure any pre-session in the next UNEG week in January in Spain. So continue working on these issues, and of course, as working group, the co-conveners or the colleagues in the panel will remain available in case any colleagues have any doubt related to intellectual disability. The evaluations and of course engaging this team. Thank you, Roxana.
Thank you, Savas, and thank you everyone for assisting today to this webinar. And you can review. We will be uploading the recording, and also there are some additional materials in the chat, so you can always go back and review. And we just would like to thank you once again for joining today. And feel free to reach out to the working group or to one of the panelists if you have any follow-up questions or would like to exchange more with them about their experiences. So feel free to do it. This is a space also create this space for exchanging. But thank you so much for joining today, and we will see you next time in the next webinar.